We're going to get started this morning. First of all, I wanted to welcome everybody to our in-service. Thank you, everybody, for joining us. We got a good turnout today, and I appreciate that. As we had said before, we are going to go back to the basics. And this is kind of a follow-up to our old in-service from last month. And for the last couple months, actually, we've been kind of going back to the basics. So today I'm here to introduce and turn the meeting over to somebody that we brought on board. Some of you may recognize her. Some of you may have seen her before, but she's going to be conducting the video today and in service. We're going to go back to basics and talk about medication and medication management and those kinds of all medical issues. So this is going to be one recording today, and then at our in-service, we'll talk about more real specific kinds of things. So this is just a basic in-service for medication and medical management. So I want to introduce Roberta. She is a nurse that I brought on board to work in the houses, mainly for SLS. She's going to be doing just a little bit of ILS also, but mainly SLS. She'll be going into the homes and talking to you guys about your clients. She'll be reviewing diets. She'll be reviewing medications. She'll be asking you questions, excuse me, about, doctor's appointments and those kinds of things. So I'm not going to take up any more time. I'm going to turn the meeting over to her. And again, her name is Roberta, and I'm going to sneak out and she's going to come in and talk to you guys.
Hi, everybody. Can you understand me well enough with the mask on?
Yes, we can hear you.
Okay, great. Okay, so we're going to start with basic medication training. So when you're in the homes, you are not actually passing medication to the client, but you are handing them the medication. So one thing you have to do, and we all know it as far as infection control, is washing your hands when you get into the home prior to assisting with the medication. So medications are on auto refill. These are just some facts that we'll go through first. So you'll notify the case manager when the client's medications are low. You'll make sure the client receives the medication according to the 7 rights, and we will discuss that later. The alternative ways staff responsibility when it comes to medication is to make sure of the following concerns: that you make sure the medications have not expired, that the medications are correctly placed in the pill trays, and any changes in the medications are documented. Side effects are monitored and reported to the case manager and the doctor and documented. And you also document that you have notified the case manager. Make sure the medications are safely stored. So when the medications are in their pill boxes, they need to be in a safe place. So if the client has visitors, children, that they cannot access those medications. Any changes in the medications are reported, and to ensure that you document after all the medications have been taken. So there are 2 types of medications. There's prescription medications that require a doctor's order, which are also routine medications. They're given at a specific time during the day. Then there are PRN or as needed medications, such as Tylenol, if a client has a headache or a Tums, and they're also considered over-the-counter medications. All PRN medications require management approval due to possible side effects or interactions with other medications our client might be taking. So there are 2 different drug classifications. prescription drugs that require a doctor's order, or over-the-counter drugs like we just discussed, which would be like Tylenol, Neosporin ointment, or Tums. Certain medications can have different reactions. There are a couple of types of drug reactions. Those that are toxic reactions that build up in the body as a result of taking too much, or the body's inability to excrete the drug as needed. There's also adverse reactions, which are bad reactions from the side effects of a drug or an allergic reaction. An individual has to, excuse me, start over. An adverse reaction is a bad reaction from the side effect of a drug or an allergic reaction that an individual has to a particular drug. Reactions that can appear as rashes, headaches, nausea, or vomiting. When a client is not feeling well or acting differently, either physically or behaviorally, a drug reaction needs to be considered, especially if a client has just started a new medication. Any suspicion of a toxic or adverse reaction must immediately be reported to the case manager. So now we'll go into labeling of your medication bottles. All prescription medications must contain a label with the following information: the drug, the name of the consumer, the strength of the drug, the dose of the drug, and the directions for use. There's also on the prescription label the doctor's name and the prescription number. If a medication is changed, you must obtain a new label with the corrected information. So the procedure is we do not give drugs that have changed color, consistency, or odor, or that expired. And your expiration date and your fill date will be on the label also. And when the medication is handed to the resident or client, excuse me, make sure that he is drinking at least 4 ounces of water. We don't crush or split pills without the doctor's order. There needs to be a reason or a diagnosis for the crushing or the splitting. So let's go over the rights. The rights tend to fluctuate between 5 rights and 7 rights, depending on the environment, whether it's a hospital, adult residential facility, a private home. But basically the rights are as follows. So we'll make sure that we have the right person. Address the client by name when you're handing them the medication, and make sure they're aware that they're taking a medication. Explain what they're taking and make sure they swallow it. We'll talk about refusals at the end. So the right medication, compare the medication to the MAR. Make sure everything matches up. Be familiar what your various pills look like. And also, what I think is very important is sometimes pharmacies market out to different distributors. So especially in generic medication, they might go to a different distributor to save some money. Therefore, they might get a pill that looks different. It might be a different shape, a different color. So just be aware and verify this with the pharmacy and the case manager. Number 3, the right dose. This is why checking the medication to the MAR and the order is important. If there's an error in the medication or the dose, don't give the medication and notify your case manager. Number 4, the right time. Follow the alternative ways protocol as far as times for medication. Like if it says in the AM, usually 8 a.m. Is the time that medications are given in the morning. If it's a PM med, it's given at 5 or in the evening. But make sure it's given within the parameters of the time. The right route, it's pretty explanatory that you give it by the right route. So most of the medications are going to be given, or the resident or client will take them orally, their pills. For inhalers, for things like asthma, shortness of breath, they're generally the oral route. So on the right documentation, make sure that you are initialing signing the MAR immediately after medications are taken. So for refusals, the client does have the right to refuse. However, we need to try to get that client to take their medication. So find out why the client is refusing. I would try 3 times to see if they'll take it. Pardon me? Yeah, you can try like I would try in 15-minute intervals, go back, and if they completely refuse to take it, notify your case manager and document that you notified the case manager. Don't beg the client to take it, don't bribe them. It's because it's their right to refuse. Another thing is, if a medication is held, say the client's going to have an x-ray or lab work, and the medication has to be held or given later, make sure that you have a doctor's order for that they're not supposed to take anything by mouth before the lab work, and how many hours prior. Sometimes it's 8, sometimes it's 12. Document that in the MAR and why it's being held. So we'll talk about doctor's appointments. There is a medical dental progress note that will be taken to the doctor appointment. You'll need to notify the case manager before and after. Take the medications or a list of the current medications. So sometimes the doctor will bring up a general list of their medications at the office, and it has a list of everything that they've ever taken. But you know what they've been taking, and there should be a current list from the MAR, or actually take the current medications that they've been taking. When at the doctor, they have the doctor fill this out in detail. The recent or the appointment vital signs, the weight, the height, they should check the blood sugar if the client's a diabetic. And please get a copy of the visit summary that the doctor's office does. That will generally have the follow-up appointment date and time. Any orders also that will also go on here, they will also be on that summary report from the doctor. Yeah. Also, if the client has recently had lab work, make sure you're getting a copy of any labs, x-rays, or radiology reports. That's important to keep on file. So there are times when the doctor will prescribe new medication or make changes. So you're to notify the case manager immediately of any changes. Then from there, the case manager will notify any other staff of the changes or the new medications, and they will follow up with that. Ask the doctor at the appointment for any specific instructions. For example, if the doctor orders a specific diet, please have them specify or elaborate on what kind of diet. Okay. Or should he order a dietary consult? Make sure that the case manager is notified. Okay. Okay. So the pharmacy will need to be notified. It's a good practice to call them after the new prescription or the change and confirm with the pharmacy that they did receive the order from the doctor, what time it will be ready for pickup, and then it can be picked up from the pharmacy or will be delivered. If it's a important medication that has to be taken immediately, like an antibiotic, pain medication, something more pertinent than a routine, which they're still important, but that needs to be addressed immediately. So when the medication arrives at the client's home, you make sure you check the label. There's usually a side effect sheet that the pharmacy will include with the medication. Make sure you go over that and be familiar with the side effects. The case manager will follow up with the MAR and anything that's been discontinued by the doctor. They will follow up with the paperwork with that in the MAR and take the old medication into the office. Anything else? So are there any questions that anybody has? Okay, so we'll go on to a couple other things. So when you're verifying the medication to the MAR, everything on the label must match the order, and all the process for this should be completed within 24 hours. If you find a medication error, or if a medication error occurs, you do not give that medication. Say that you find a medication that is the wrong dosage, you don't give that medication. You hold that and you notify your case manager immediately. And always make sure that you're washing your hands, and especially before leaving, and watching your infection control techniques. So like digoxin and stuff. So there are certain medications that your client might be taking that are easily absorbed into the skin, and make sure that you are not touching any of their pills or medications for that matter. There are medications like digoxin, for example. If you actually touch that pill, you could easily come down with a headache or get dizzy. So make sure that you're not touching the medications. You're just handing the pill box to the client. So any questions? Okay, so make sure that the pills match the count to the MAR. So if the pills are off, you can notify the case manager. Okay, and that pretty much covers everything, if there's no questions. Okay, but like just to reiterate, the physician's communication sheet, progress note rather, very important that that goes to the doctor and that's filled out in detail. And I guess that covers. Thank you.